I had a blast at this morning's Q&A. Unfortunately, I didn't get to answer all the questions. That's what this video is for. In this after-party video, I'm going to answer as many of the unanswered live questions as possible. Stay tuned, because that starts right now. Howdy. Thanks for learning about MS with me, Aaron Boster. I started this YouTube channel to help my own MS clinic patients learn between visits. And it's my hope that through these videos, I can help you learn too. This morning, I had a blast doing a live Q&A, Ask Me Anything Multiple Sclerosis. There were almost 100 folks that jumped online early this morning on Saturday, and I really enjoyed answering your questions. Unfortunately, I couldn't get to all of them during the live feed. I've gone back and picked out key awesome questions, grouped them based on topic, and I'm going to answer them in this video. So let's jump in. Lynn Butters writes, Restless Leg Syndrome. Restless Leg Syndrome is a compulsion to need to jiggle one's legs, and it typically occurs when the legs are at rest. So certainly when you get in bed at night to go to sleep, but also a lot of times even during the day when your legs are just still. And restless leg can be caused by multiple things. But there is a recent paper that came out suggesting that people with MS are at increased risk of restless leg. There's also some evidence that this is probably coming from spinal cord disease. And if you have those symptoms, please bring them to the attention of your provider. There's a few tests to undergo, and there's options for treatment. And so you don't have to live your life like that. Murad Williams writes, Dr. Boster, it's difficult to communicate to docs the different types of dizziness I get. What's the difference between being dizzy, lightheaded, and having vertigo? Well, that's a fantastic question. And it's true that when people say the word dizzy, they don't always mean the same thing. When I hear a person talking about dizzy, I try to divide it into one of three buckets. The first one is, I stood up too fast and I feel like I'm going to black out and I have to hold on to the table and I lose my vision and things go quiet for a second. That's pre-syncope or a risk of passing out. And sometimes people experience pre-syncope and they call it dizzy. And so that's the first category. Now, when you find out that someone's pre-syncopal, there's an entire workup that's done to explore that, looking at the heart, looking at the vessels, and there's a whole workup to be done. But that can get you on the right path. The second one that I want to listen for is I don't have my sea legs about me. I feel like I'm drunk and I'm stumbling, or I'm on a boat and I'm stumbling about. This is a disequilibrium. And sometimes when people experience a disequilibrium, they call it dizzy. Now, this to me suggests problems with the cerebellum and its connections, and it certainly helps guide me as I work someone up for dizzy. The third one is a hallucination of spinning movement, either that you're spinning or that the room's spinning around you, and that's the definition of vertigo. And vertigo can be caused by central problems in the base of the brain or peripheral problems inside the inner ears. And so there are further questions and tests that can help us down that pathway. So when you say dizzy, I try to put it in one of those three categories. Kathy Gowan writes, how does a UTI make our symptoms worse? Kathy, that's a great question. Think about it this way. The nervous system is like a bunch of wires, and in the setting of MS, the wire can get frayed. And so with this analogy, imagine that you plug in one thing to that wire, and it works fine. Say it's a Christmas light, and that light lights up. But then you plug in 16 more lights. You overload that frayed wire, you short circuit, and then it doesn't work. When you unplug 15 of the lights and you're down to just that one light again, it works fine. This analogy helps us understand the nervous system. In the setting of multiple sclerosis, it's not functioning at 100%. It's functioning at maybe, say, 80%. And that's adequate to get by day. But if you tax the system, it can short circuit temporarily. And that's exactly what happens with a urinary tract infection in the setting of MS. You raise your core body temperature as you try to fight the infection. It overloads your body and makes your nervous system work harder, if you will, and it can short circuit. In that setting, baseline symptoms can get much worse, and when the infection goes away, they go back down. Prieto writes, Good morning. What are the reasons for extreme fatigue in MS? And that's a great question. When you have focal damage to the brain and spinal cord, the brain and spinal cord create workarounds. They literally rewire. And you may be able to get the job done after your brain rewires and heals, but you're now using a lot more brain tissue to get the job done. So whereas before maybe only a little bit of brain was required to do a simple task, now you're activating massive amounts of brain for a long period of time to accomplish that same simple task. It's this exertion of brain energy that I think gets used up really quickly, and the result is that the person with MS suffers from a pathologic fatigue. This concept is sometimes described as the functional reserve, and we think of it that in the setting of MS, that functional reserve gets smaller, and so when you use it up, boom, there's no more reserve left. I have several videos on the channel that talk about pathologic fatigue, and I'll try to include a card up above and certainly links down below in case you wanted to check that out. The next two questions are on cannabis and alcohol. Phelan writes in, how do you feel about marijuana? I smoke it every day. What do you think about that in MS? Phelan, I have a couple videos on this channel that I've done where I talk about cannabis and multiple sclerosis. I'll make sure to include links down in the description below so you can check those out. In a quick nutshell, I'll review with you 3 things that science has demonstrated to be true, or at least I believe it probably has evidence to support as it relates to MS. Number 1, cannabis can help MS pain. Number 2, cannabis can help MS spasticity. Number 3, cannabis can interfere with MS cognition. And so to learn more, check out those videos. Shakir Bashir writes, so obviously, being newly diagnosed is super scary in pretty much every way. A tried and trusted way of overcoming fear is to drink alcohol. Thoughts? First of all, my heart goes out to you with a new diagnosis. I recently, over the Christmas holiday, made a message for folks that are newly diagnosed. And if you haven't seen that, Bashir, I'd like you to check it out. And I'll leave a link in the description below. I personally don't think that using alcohol to overcome fear over the long term is the most successful option. And I think that there's risks that it can create more problems than you'd like. So whereas you may have found something that seems adaptive at the time, I certainly hope that you seek out other ways that you can also try to overcome this new thing. I'll share with you that it takes my patients on average 1 to 2 years before they're completely comfortable with their MS, how it affects them. And I hope that your journey is a smooth one as you become comfortable with your diagnosis. There were several questions on MRI and brain volume and things related to brain anatomy, and so I'll review those now. Francia writes, and which drugs slow shrinkage in brain volume best? Now, this is a really big question. Let me start to unpack it. After the age of 18, all human brains are pre-programmed to shrink. And that's normal, in the same way that your skin gets thinner as you age. But in untreated MS, brains can shrink upwards of 10 times faster than normal rates, and that's really bad for you. It correlates with disability and cognitive impairment and a lot of stuff that's bad. And MS therapeutics, disease-modifying therapies, have been shown to be able to slow the rate of brain shrinkage, but they don't all do it the same. When I look at the data in 2019 about the available FDA-approved therapies, certain drugs do a better job of slowing brain shrinkage as compared to others. So what are some of the best? I think that alemtuzumab, Lemtrada, ocrelizumab, Ocrevus do probably the best bang-up jobs. I think there's some data supporting fingolimod in that regard. I think there's some data with Aubagio in that regard. I've been a little bit disappointed in the brain volume data for Tysabri, and I don't really feel that the brain volume data for the interferons or for Copaxone are really all that robust. Just my 2 cents. David Downey writes, what if you can't have an MRI? I have an ICD pacemaker. Can a CT be used to see lesions? And so thank you for bringing this question up, because this does occur. MS existed long before the MRI was created. However, since the 1980s, we've increasingly used MRI to diagnose and monitor MS. And in many ways, we sort of become increasingly dependent upon it. In 2019, our diagnostic criteria are heavily dependent on MRI. And the way that we monitor MS disease activity also involves MRIs. And yet there are people where they simply can't get them for whatever reason. There were criteria that predates the MRI criteria, and we can fall back on those. They may not be as accurate, but they're still very, very solid. And I'm talking about Poser criteria, which came out in 1982, I believe, and this predates the advent of everybody using MRIs. And so we can go back to those older ways of trying to diagnose MS and trying to monitor and manage MS. It's not ideal, but again, you're a human being and you happen to have MS and you happen to have a pacemaker. And so we have to deal with both. Melanie Parker writes, Dr. B, can you look at an MRI and tell what cognitive issues exist based on where the black holes and lesions are? Not exactly. Now, in neurology school, we spend years mastering the art of you tell me 3 or 4 symptoms or you show me 3 or 4 signs on exam, and I localize in the brain or spinal cord down to the millimeter exactly where that problem is. And that works very, very well when studying vascular problems like strokes. It doesn't play out that way, though, in the setting of MS, because the MS lesions cause inflammation and the brain tries to rewire. So it's not always one for one where you can point at a spot and say what the problem is. There are areas in the spinal cord and the optic nerves where we certainly can do that, but this question is about cognition. The very best indicator for cognitive impairment when looking at the MRI is the brain volume. And so if you notice that there's a lower brain volume or cortical volume or deep gray matter volume, that person would be at increased risk of cognitive impairment. It doesn't mean they're going to have it. It would just be an MRI finding that would make you be concerned about it. Melody also writes the following question. Is there a specific point on the brain where inflammation causes mood changes and depression, or does something else affect these? Now, this is a really interesting question, and there's an entire field evolving looking at functional imaging and PET imaging and trying to deduce exactly where things are occurring. But it's an evolving science. There are some papers that suggest that areas of the front of the brain that have cortical thinning in MS may be better associated with depression. But science is still evolving, and so I think over the next 5 to 10 years, we're going to become increasingly good at using these new non-conventional advanced techniques to try to localize lesions that correlate with these so-called invisible symptoms. And before we leave, I want to read something that Sonja wrote, which really warmed my heart. She said, "Reading everyone's post, I don't feel as crazy. I was once told that it was all in my head and that I need to get on anxiety medicines. I am so grateful for this group." Well, that makes my day, and Sonja, I'm also grateful for this group. Thank you all for tuning in and learning about MS with me, Aaron Boster. And if you like this video, that's awesome. Please take a moment and subscribe to the channel. And until my next video, take care.